Good evening. We begin tonight with breaking news concerning former President Joe Biden. In an official statement released today, it has been confirmed that Mr. Biden has been diagnosed with prostate cancer. The diagnosis describes a Gleason score of 9 categorized as grade group 5 with confirmed metastasis to the bone. Medical experts consider this to be one of the most aggressive forms of prostate cancer. A Gleason score of 9 indicates a high-grade tumor that carries a significant risk of rapid progression. Grade Group 5 represents the most severe classification within prostate cancer grading. In Mr. Biden's case, the cancer has already spread to the bones, a stage that significantly lowers the chances of long-term survival. According to medical analysts, prostate cancer at this stage is often accompanied by noticeable urinary symptoms. This detail, included in the report, suggests that the disease may have been developing unnoticed for some time. It is also reported to be hormone responsive, which means treatment may focus on reducing testosterone, a hormone known to fuel the growth of prostate cancer cells. Treatment strategies for this type of cancer commonly include hormone therapy, using medications such as Lupron, which suppress testosterone production, or receptor-blocking drugs that prevent testosterone from binding to cells. In some cases, a combination of therapies, surgery, radiation, and hormone suppression is employed to control the disease more effectively. Experts point out that more than 80% of men over the age of 80 may have prostate cancer cells in their body. However, when cancer reaches this advanced stage, the 5-year survival rate drops to approximately 30 to 40%. Depending on how well the patient responds to treatment. Questions are now being raised regarding early detection. The cancer was reportedly discovered through a physical prostate exam, rather than a spike in PSA prostate-specific antigen levels, which are typically monitored during routine screenings. It remains unclear whether previous PSA levels were elevated or within a normal range. Medical professionals note that while PSA is a helpful tool, it is not always a definitive indicator of cancer. In some cases, prostate cancer can be present even with normal PSA levels. That makes physical examination and imaging tests like MRI critical in early detection. Advanced treatment options now include precision radiation therapies that minimize side effects and robotic-assisted surgeries for prostate removal. When applied early, these interventions can be highly effective. However, in metastatic cases such as this, the focus often shifts from cure to long-term management. Prostate cancer remains one of the most treatable cancers if caught early. Once it spreads beyond the prostate gland, particularly to the bones, the complexity of treatment increases dramatically. While official statements remain limited, the medical community will closely monitor Mr. Biden's progress in the coming months. Experts emphasize the importance of early intervention, as well as the potential for modern therapies to extend both survival and quality of life. This story is still developing, and we will continue to follow updates as they become available. Following the announcement of former President Biden's cancer diagnosis, attention now turns to the timeline and detection methods surrounding the discovery. According to available information, the cancer was identified through a physical prostate examination rather than through elevated PSA levels. This has raised questions as the PSA test is a common and widely used method of screening for prostate cancer in men over the age of 45. Medical experts have clarified that while PSA is a valuable tool, it is not infallible. In certain cases, patients may develop aggressive prostate cancer despite having PSA levels that appear to be within the normal range. It is also important to note that prostate cancer typically progresses without symptoms in its early stages. The emergence of urinary symptoms, such as those described in Mr. Biden's case, indicates that the disease had already advanced significantly by the time of diagnosis. There are 2 principal types of hormone-related treatments for prostate cancer. One method involves halting testosterone production using a drug like Lupron. The other blocks testosterone from attaching to receptors on prostate cancer cells. In some cases, both approaches may be combined with surgical removal of the prostate or targeted radiation therapy. Modern radiation techniques, such as seed implants or targeted beams, have significantly improved outcomes. These methods are now more precise and come with fewer side effects than in years past. Surgical procedures, particularly those involving robotic assistance, have also evolved, allowing for greater precision and faster recovery. In many advanced cases like this one, physicians may recommend a multi-pronged approach combining hormone therapy, surgery, and radiation. While this combination does not guarantee a cure, it may help slow disease progression and improve quality of life. Despite these treatment advances, the diagnosis remains serious. A Gleason score of 9 and grade group 5 are among the most aggressive types of prostate cancer. Metastasis to the bone further complicates the situation. According to cancer survival data, the 5-year survival rate for patients with bone metastasis ranges between 30 and 40%, depending on the response to therapy. The White House press corps and public health experts have expressed surprise at the timing and severity of the diagnosis. Questions have been raised about how such an advanced stage of cancer could remain undetected during Mr. Biden's time in office, when regular health monitoring would be expected. However, doctors caution that even with frequent screenings, aggressive cancers can sometimes develop and spread rapidly, evading early detection. At this time, there has been no official word on whether Mr. Biden will undergo surgical removal of the prostate. It is also unclear whether radiation therapy is currently part of the treatment plan. These decisions are typically based on multiple factors, including the patient's overall health, the extent of cancer spread, and responsiveness to hormone therapy. Bone metastases, such as those reported in this case, are not only medically complex, but also potentially painful. Radiation may be used not only to target the cancer, but also to reduce discomfort and improve the patient's quality of life. Side effects from treatment are also a concern. Hormone therapy can lead to significant fatigue and reduced energy levels. These symptoms are often among the most difficult for patients undergoing long-term therapy. Physicians will closely monitor for these effects, particularly in elderly patients. While the prognosis remains guarded, doctors remain hopeful that the hormone-responsive nature of the cancer will improve treatment outcomes. The next few months will be critical in determining how well the former president responds to therapy. Progress will likely be measured through imaging scans, symptom management, and hormone level monitoring. Despite the severity of this case, the medical community has made substantial advances in prostate cancer treatment. Early detection remains the most effective tool for long-term survival, but even advanced cases may benefit from modern targeted interventions. The coming weeks will provide a clearer picture of Mr. Biden's condition and treatment plan. As more information becomes available, we will continue to provide updates on this developing story. While the medical implications of former President Biden's diagnosis remain the central focus, there are also growing concerns about the broader public health message. Prostate cancer continues to be one of the most common cancers among men worldwide. According to physicians, up to 80% of men over the age of 80 have detectable prostate cancer cells. However, not all of these cases are dangerous. Many are slow-growing and non-aggressive. What makes Mr. Biden's case alarming is the level of aggression and the speed at which it appears to have progressed. The Gleason scoring system used to grade the aggressiveness of prostate cancer ranges from 6 to 10. A score of 9 places the cancer in one of the most dangerous categories. Grade group 5 likewise indicates a highly abnormal cellular pattern that often spreads rapidly. When cancer metastasizes to the bone, as in this case, it indicates a transition from a localized condition to a systemic one. This shift greatly impacts treatment decisions and long-term outlook. One possible course of action for advanced prostate cancer is radiation therapy to bone lesions. In many cases, this can reduce pain and slow the growth of metastatic tumors. Targeted radiation can also help shrink tumors in specific areas to relieve symptoms and improve quality of life. These treatments are often paired with hormone therapy to reduce the cancer's fuel source, testosterone. At this stage, hormone therapy remains a cornerstone of treatment. By limiting testosterone, doctors aim to weaken the cancer and reduce its ability to grow. Medications like Lupron are commonly used to shut down the body's production of this hormone. Other drugs may block testosterone receptors, preventing cancer cells from receiving growth signals. The main side effects associated with these treatments include fatigue, emotional changes, and reduced stamina. For elderly patients, this can lead to a noticeable decline in daily activity levels. In many cases, physicians must weigh the benefits of aggressive treatment against its impact on the patient's quality of life. Sources close to the former president have not released specific details regarding the treatment regimen. It remains unclear whether surgery or radiation to the prostate itself will be part of the strategy. In some cases, surgery to remove the prostate is performed even in metastatic settings to reduce urinary symptoms and local tumor burden. However, this decision is highly individualized and based on a wide range of medical assessments. With the cancer now known to have spread to the bone, many experts believe that a full-course treatment approach will likely be pursued. This may involve an aggressive regimen of hormone therapy, targeted radiation, and possibly chemotherapy in later stages if resistance to hormonal treatment develops. The next several months will be critical in monitoring response to therapy. Dr. Mark Siegel, a senior medical analyst, noted that the fact this cancer is hormone responsive provides a degree of optimism. Responsive cancers can often be slowed and managed with proper medication. The primary goal at this stage is to prevent further spread and maintain comfort and function. Still, the surprise remains. With access to the most advanced medical care, many are left questioning how such a severe case was not detected earlier. Medical professionals explain that despite regular screenings, some aggressive cancers may progress silently. PSA tests, though essential, are not always conclusive. It is possible to have a low PSA reading and still develop advanced prostate cancer. This has renewed conversations within the medical community about improving detection protocols. MRI imaging of the prostate has significantly evolved in the past decade. High-resolution scans now allow doctors to identify suspicious areas with much greater precision than before. When paired with PSA tracking and physical exams, these imaging techniques can lead to earlier and more accurate diagnoses. Despite advancements, early detection remains a challenge, especially in cases that show no symptoms. By the time pain or urinary issues emerge, cancer may have already moved beyond the prostate gland. The medical outlook now depends largely on how the former president's cancer responds to treatment. Doctors will monitor PSA trends, testosterone levels, imaging results, and symptom progression over the next few months. A strong response may stabilize the condition and allow for long-term management. A weak response, however, could indicate the need for second-line therapies. Former President Biden, now 82 years old, is within the high-risk age group for prostate cancer. Though age alone is a significant factor, there have been no reports of other major risk contributors in his case. As treatment continues, medical professionals and the public alike await updates on his health status and treatment outcomes. As the nation processes the news of former President Biden's prostate cancer diagnosis, attention also turns to the effectiveness and limitations of the PSA test, a tool long considered central to prostate cancer screening. Medical experts emphasize that while the PSA or prostate-specific antigen test remains a valuable resource, it is not definitive. Physicians now focus not just on absolute PSA levels, but on how those levels trend over time. For example, a gradual rise from 2.0 to 3.0 or from 3.0 to 4.0, even if still technically within a normal range, may warrant further investigation. These trends, combined with family history, age, and physical examination findings, help guide clinical decisions. However, the PSA test alone is not always sufficient to detect aggressive forms of cancer early. This has prompted a broader shift toward more comprehensive evaluation strategies, including the increased use of MRI technology. Modern MRI imaging has significantly improved in recent years. Today's scans offer greater clarity and allow physicians to detect abnormal tissue within the prostate that may not be visible through standard screening methods. These images can guide targeted biopsies, focusing specifically on the suspicious areas, and provide an index of suspicion regarding cancer presence and severity. Had there been a suspicious rise in PSA or any irregularities on prior exams, an MRI would likely have been ordered. From there, doctors would determine whether to conduct a biopsy and begin intervention sooner. In Mr. Biden's case, however, the discovery appears to have occurred only after symptoms emerged, by which time the cancer had already metastasized. When prostate cancer advances beyond the gland, particularly into the bones, the window for curative treatment narrows. Although aggressive therapies may slow disease progression, they are unlikely to result in full remission once the cancer has spread extensively. Radiation oncologists now employ targeted radiation to specific bone lesions to manage pain and reduce tumor growth. This form of localized radiation is less invasive than earlier methods and is often used alongside systemic treatments like hormone suppression. Hormone therapy remains the foundation of treatment for metastatic prostate cancer. Drugs such as Lupron reduce the body's testosterone levels, essentially starving the cancer of the hormones it needs to grow. Other medications may prevent testosterone from binding to prostate cancer cells. The combined effect is intended to limit the cancer's fuel and slow its activity. Still, these treatments are not without consequences. Common side effects of hormone therapy include extreme fatigue, reduced physical stamina, emotional fluctuations, and general listlessness. In some cases, patients may also experience bone thinning or changes in muscle mass. These effects are especially impactful in elderly patients whose overall resilience is lower. Former President Biden's age 82 is a significant factor in both his risk profile and his potential response to treatment. While age alone does not dictate outcome, it does influence how aggressively doctors can treat the condition and how the body may tolerate therapy. Experts estimate that in the coming 3 to 6 months, physicians will gain a clearer picture of how the cancer is responding. Monitoring will include repeated PSA tests, hormone level checks, and imaging to track the size and behavior of both the prostate tumor and the bone lesions. If hormone therapy proves effective, disease progression may be slowed for several years. However, if the cancer becomes resistant to initial treatments, oncologists may need to consider second-line therapies or more experimental approaches. At this point, details remain scarce regarding whether surgical removal of the prostate will be considered. While not always recommended in metastatic cases, some specialists choose to remove the prostate to ease urinary symptoms and reduce the local tumor burden. Robotic-assisted surgery has made this procedure safer and more precise, but the decision must be made on a case-by-case basis, weighing risks and potential benefits. Beyond medical treatment, the psychological and emotional aspects of a cancer diagnosis, particularly one so advanced, are substantial. Public figures often face the added burden of constant scrutiny and speculation. While Mr. Biden's team has chosen to release key medical facts, the personal impact of this diagnosis remains private. As public attention stays focused on the former president's condition, doctors continue to use this opportunity to raise awareness about prostate cancer. Early detection, they emphasize, remains the best defense. Regular screenings, attention to changes in PSA levels, and timely imaging when needed are critical to improving outcomes. Despite advances in technology and treatment, prostate cancer remains a leading cause of cancer-related death among men. However, when caught early, it is also among the most treatable. Mr. Biden's case highlights both the progress of modern medicine and the challenges that remain. In summary, former President Joe Biden has been diagnosed with an aggressive form of prostate cancer characterized by a Gleason score of 9 and classified as grade group 5 with confirmed metastasis to the bone. The diagnosis marks a critical stage in the disease, with treatment now focused on slowing progression, managing symptoms, and maintaining quality of life. Medical experts stress that despite the seriousness of the condition, advancements in treatment, particularly in hormone therapy and targeted radiation, offer hope for disease control. The former president's cancer is reported to be hormone responsive, which improves the chances of managing the illness through medication designed to suppress or block testosterone. However, the path ahead will not be easy. Common side effects such as fatigue, discomfort from bone lesions, and emotional stress are expected challenges during the months to come. His medical team is likely to pursue an aggressive treatment strategy, and close monitoring will be essential to assess how well the cancer responds. This case also serves as a powerful reminder of the importance of routine screening and early detection. Prostate cancer, when caught in its early stages, is among the most treatable cancers. Once it spreads beyond the prostate, particularly to distant organs like the bone, the battle becomes more complex and the treatment goals shift from cure to management. Doctors encourage men, particularly those over the age of 45, to speak with their healthcare providers about PSA screening and risk factors. Modern tools, including high-resolution MRI scans and targeted biopsies, continue to improve detection and outcomes. Paying attention to gradual changes in PSA levels rather than waiting for symptoms to appear remains key. As for former President Biden, no further official medical updates have been provided at this time. The public and medical community await developments in the coming weeks as his treatment progresses. What remains clear is that he faces a significant health challenge, one that will require strength expert care and time. We will continue to monitor this story closely and provide updates as they become available. For now, we extend our thoughts and well wishes to the former president and his family during this difficult time. Stay with us for more coverage ahead.